I think it's important because we need things like this. We need a lot of people don't have somewhere they can go where they feel safe or where they can talk about something, because maybe things aren't good at home and someone will judge you or get mad at you if you do a certain thing. And here they'll accept you for who you are. And I think that's very helpful for most people, actually for everyone. And you feel like you're loved here. And I think that's what people need, is to be loved.
Today's adolescents face many health concerns, from chronic disease like asthma and diabetes to drug and alcohol use, poor nutrition and lack of physical activity, teen pregnancy and STDs, violence, and mental health issues.
In our community, we see a lot of diabetes, a lot of obesity. Some of the kids themselves have high blood pressure already due to their, family history and their obesity status. So we also see common things like colds and coughs and headaches and stomach aches. A lot of mental health issues, stresses, and family problems.
I often see that a lot of students are stressed because of the issues that they face at home or outside of school or in school. A lot of the students that go to my school have family members or parents that are drug abusers. And then some of them just deal with struggling to maintain good grades, or some of them don't have the grades that they wish they did have.
I think youth are experience a lot more violence in their communities, and so there are a lot more mental health issues, a lot more depression.
Adolescent health is complicated by the fact that youth access fewer health services than any other age group, and in California, approximately 1 in every 10 child or youth is uninsured.
The kinds of problems that we see, health issues, a lot of them are uninsured. If they do have insurance, oftentimes they're not utilizing their primary care physician. So we're trying to bridge them back into their medical home, provide acute services, get them hooked up with the medical home. Many of the students use emergency rooms and go across the border to Tijuana to access health services. So we're another resource for them and their families.
There's certain things that youth will not see maybe their regular doctor for, regular provider. Maybe they're scared. And so with things, dealing with sex and drugs and mental health issues, there's a lot of trust that needs to be built, even in a school-based clinic. And because we have the access, we can build the trust. And so confidentiality seems to work very well here too.
Youth come to school every day suffering from conditions that impact their ability to learn and their ability to succeed.
At a big public school, when you're teaching between 100 and 150 students a day, you notice as a classroom teacher that in any given class that there are a handful of students who aren't able to bring their whole selves into the room. Their head is down, they're exhausted, they're distracted, and I wanted to be able to respond to the need that I was seeing in some meaningful way.
School health centers offer a solution by putting health care where the kids are, offering low to no-cost health services in a safe, familiar, accessible, and youth-focused way.
The doctor's very nice, come in, just explain everything to me. I don't even have to ask him a question because sometimes I don't quite understand everything they mean. And he explains everything to me really easy before I even have to ask him a question.
School-based health center is basically, it's like going to your doctor or your medical facility. It's like that, but it's kind of for teens. It's confidential. You get shots, immunizations, physicals, eye treatment, and family planning services, which is really great. Everything is just for it being free, and for it being students, it's just a wonderful place to be. And it's really confidential. It's a great environment.
The testing clinic is it's really a safe environment. A lot of people go there for many different things. There is a stigmatism though on it that you're going there to get condoms or HIV testing and stuff like that. Mostly a lot of people go there for mental health services.
School health centers provide primary medical care like any doctor's office or health clinic and work in collaboration with the school. Staff include nurses and nurse practitioners, mental health care providers, and part-time physicians. Services are tailored to fit the community, reflecting language and cultural diversity. And in addition to primary care, services can include mental, reproductive, and dental health care.
I do everything that a primary care provider would do. So I see youth for everything from asthma to pregnancy prevention, to STD treatment, to sports physicals, to I help out with immunizations. We work with the mental health department and we work with the health education department in the clinic. So the medical people do a lot of referrals.
What I do here is I basically help our patients with whatever resources they're needing. The school nurses will call me and say, Angie, there's a family here. They don't speak much English, but the child really needs to see a dentist. We have a lot of families that many of them are undocumented, of course, and all they basically just want is maybe a physical for their child. And we, of course, we provide physicals here at the clinic.
School health centers are making a difference in kids' lives through comprehensive health care and social support for youth. They work because they enable teachers to teach and students to learn.
I come here for academic counseling and regular counseling and just to talk.
I think just being able to have it there for the kids has changed my teaching. It was huge to be able to say that, you know, here's this place, it's 100 yards away, you can get everything you need there.
School health centers take health care beyond the walls of the exam room, creating a supportive environment and connecting youth to activities and leadership opportunities.
We had a group here called Project Respect. We go over things that we've seen at school, and sometimes we document things that happen and how we approached it. They taught us different techniques of how to de-escalate situations. We talked about how we did it and how we can further stop the violence and the discrimination at our school.
I was really interested in the things that they were doing, how much they wanted to help the community. That's how I started a program up here at Tech. It wasn't actually a program, it was more like a concert that I wanted to do called Oaksword. It was an art concert that I wanted to be put on from Oakland Tech students for Oakland Tech students. The whole atmosphere was just talking about how Oakland can change and what it can do and what we need to do and what are the issues that nobody talks about that we know are there.
So we started kind of a group called we're a clique now, the Rainbow Clique. And basically what we do is we go to other schools and projects and stuff like that, and even classes. And we basically talk about discrimination and homophobia at our school and what it looks like. And we just go there to, you know, make sure that they're aware of it and help them get on the path to doing the type of stuff we're doing now here so that they can change it at their own school.
A lot of people think that youth don't have a voice because we don't have a place or a time to actually express our voice, but we do have a voice. All we need is the opportunity to express our decisions and what we want to happen. And when we do take part and get engaged in whatever it may be, it doesn't just affect us. What we learn from what we do, we pass that on to our communities.
California is home to 140 school health centers located on or near school campuses that served an estimated 262,000 students during the last academic year.
A couple of months ago, I messed up my knee. Like, I was running, I fell down, I messed up my knee. It was in the morning too, so luckily they were open in the morning by that time. I went there, I don't know what they did, they made it a bit better until I went to my doctor's.
I went to the clinic with a headache. It was my 9th grade year and I was like, my head hurts and I don't know what to do. And they gave me something to eat and they gave me Advil, and then they realized my head hurt because I wasn't sleeping. And then after coming a couple of times, they were like, wow, you don't sleep a lot. And then they started just wondering, like, why aren't you sleeping? And they're asking me questions. They got me to tell them some things that were going on at my house, and they realized that I needed other help beyond just an Advil.
It's easy access. You don't have to leave school, you don't have to go anywhere. You know everyone.
You wish you had a place like this in high school. When you were in high school, when you were my age, and I know that for a lot of people, this is a really safe place for everybody to come to. And
For me, it's just somewhere I can come when I'm feeling a little stressed and I need someone to talk to. They're always there, you know, when we need comfort or just some place to come and be ourselves. And it takes us away from all the stuff we go through at home or at school and class. So that's why I come to the Community Project. It's like my home away from home.